hypothetically assume that we are talking about children, because we do not do any of other cases, ocular surface cases under GA, we don't need to. So even if it's a child, if we are able to understand that not every time a limbal transplant is required in chemical injury, well, that's good enough. Lot of time we are not able to remove the chemical and it may still have persistent inflammation, and hence even your definite surgery, and if at all, if we are talking about autoslet, would not be the best idea. Alloslet gives us a temporary window period and which we can utilize. I think we have to find a bike, you need to scoot there. Yeah.
Thank you very much, Himanshu. We go to the last debate. Unilateral central corneal opacity in a 5-year-old. I don't think Dr. Jatin Asher is here. And now I request Dr. Ashmi Deshmukh to talk about the importance of penetrating keratoplasty in such a situation. Can we have the slides on, please?
Good morning, everybody. So the topic is unilateral central corneal opacity in a 5-year-old child. I've been asked to speak for penetrating keratoplasty. So pediatric penetrating keratoplasty has been considered as a high-risk keratoplasty because of the following reasons. One is there's technical difficulty in the surgery. There is a very high rate of graft rejection. There are challenges in the follow-up examinations, and problems regarding amblyopia are also involved. But there are certain criteria for optical iridectomy. One is that corneal area should be sufficiently clear to warrant an optical iridectomy. So the kind of picture that I have shown here, there's no clear area. So in such cases, penetrating keratoplasty might work better. Again, the site preferred is inferonasal, and superior area is least preferred because it gets hidden by eyelids. So in certain situations, we may not have a choice. Coming to the quality of vision, in optical iridectomy, there is eccentric and blurred vision, but penetrating keratoplasty can provide a central and steady vision. And coming to the field of vision, again, in optical iridectomy, there will be restriction of the field of vision, but in penetrating keratoplasty, a central and complete visual field can be provided. Again, penetrating keratoplasty can remove the opacity altogether. So in a single surgery, you are actually completely removing the cause. But in optical iridectomy, there is always a chance that you might want to do a penetrating keratoplasty at a later stage. Coming to stereopsis, for a proper binocular vision to develop and for the child to have a proper stereopsis, if there is peripheral vision in one eye and central vision in the other eye, then the stereopsis may not develop very well. Then in the presence of a corneal opacity, cosmetic appearance of the child is also different from other children of the same age, and in such a case, the child may be subjected to social pressures. Behavioral abnormalities and personality development of such a child may be affected, and that should always be kept in mind. Then coming to pediatric keratoplasties, these days there are studies which have shown improved success rates like 83%, 76%, and even up to 88%, which is not a very bad rate of success of pediatric keratoplasties. So if preoperatively a complete ocular evaluation is done, and if there are multiple subspecialty services that are involved, including an ASOCT and UBM, and B-scan is done, and if the post-operative management is also done across ophthalmic subspecialties, including glaucoma management and proper amblyopia management, then long-term visual prognosis can be improved. So to conclude, pediatric penetrating keratoplasty is challenging. Successful transplantation with good graft survival can be obtained if a multidisciplinary approach is there. And improved success rates owing to advances in corneal microsurgeries, post-operative management, and a better understanding of risk factors may help in predicting and preventing poor outcomes. Thank you.
Thank you very much, Doctor. But the only assumption throughout your talk was that the graft was going to remain clear, whether we are talking about cosmesis, whether we are talking about...
Yes, sir. Actually, to be very honest, I have always seen optical iridectomies being done, and pediatric penetrating keratoplasties is only through literature that I have actually gone through. So rate of rejections and all, when I have seen patients, rates of rejections have been there.
But that's very nice of you to have told this. But you have to understand, just because the other person is not there to defend himself, there is a role for optical iridectomy in children. And even though this infranasal concept is often taught as a preferred thing,